Hello, I'm Phil Miller, Vice President of Communications with Merritt Hawkins, a national physician search and consulting firm and a company of AMN Healthcare. I'd like to talk briefly about a new white paper that we have developed. The white paper is part of our overall effort to provide the healthcare industry with thought leadership concerning physician staffing and related topics. This thought leadership includes surveys that we have conducted for many years looking at physician compensation and other issues, books that we have written on physician staffing, speaking presentations, and white papers such as this one. At the end of this video, we'll provide you with some information where you can obtain more information about this particular white paper and some of the other thought leadership efforts that Merritt Hawkins conducts. The new white paper is entitled Trends in Incentive-Based Physician Compensation. And it looks at how physician compensation is changing from metrics that are based predominantly on volume. In other words, the number of patients that physicians see, or the amount of revenue that they generate, or the amount of work units that they perform. All of these things tend to increase the number of procedures and other forms of utilization that take place in healthcare. A fundamental part of healthcare reform is to restructure the way physicians practice. And of course, to accomplish that, the most effective way is to incentivize new types of behaviors. So new physician incentive programs are being developed that incentivize doctors to do things other than focus strictly on volume. This process we call evolving from volume to value. The white paper looks at some of these new compensation models. I'll briefly summarize them. First, we indicate in the white paper that volume, the traditional form of physician compensation, will continue to be a compensation metric for the foreseeable future. Doctors will still be incentivized to see patients. We have a lot of new patients entering the system through health reform and just through population demographics. So we will need to encourage physicians to see many patients. So that's one reason why we believe volume will remain an important part of physician compensation packages. And again, that volume will take the place of patient seeing, work units known as RVUs, and billings. However, qualitative metrics will gain ground. These metrics will be built around certain treatment protocols that will be specified for different types of diseases. And physicians will be rewarded for following those protocols and for achieving better than average results. Readmission rates will have an impact on physician compensation. There is a movement to reduce the number of patients who are readmitted once they are discharged from the hospital. Both hospitals and physicians will be able to share in savings that they can generate by reducing readmissions to the hospital. Doctors will also be measured on certain subjective metrics. These subjective factors include patient satisfaction. According to the Medical Group Management Association, patient satisfaction metrics were incorporated into only 20% of physician compensation plans in 2008. By 2009, in just 1 year, 61% of medical groups indicated that they incorporate patient satisfaction into their physician compensation plans, and we expect that to continue. Bundled payments will also have an impact. Episodes of care will be paid for in one bundled payment. Doctors will be able to achieve savings along with the hospital if they can provide care for less than a certain target amount. They'll be able to share in those savings through bundled payment programs that are now being developed. The white paper concludes with 3 examples of emerging physician compensation plans, one of them based on a point system bonus structure in which doctors will receive points for patient satisfaction, quality metrics, volume, and other metrics. And the higher the point total that they receive, the higher the bonus that they will be able to receive. These are some of the many ways in which physician compensation is changing. This trend is going to be vital to the success of healthcare reform because physicians control so much of the healthcare dollar. If you can change the way physicians practice, how they treat patients to get them to focus on value and cost metrics, I believe that the major goals of healthcare reform can be accomplished. If you would like more information about this white paper or other Merritt Hawkins surveys, books, and speaking presentations, you'll be able to access them through calling us or at our website and following us some information about how you can contact us. Thank you.